Good afternoon, Laverne. We're going to try this again. My name is Mayor Jason Cole. With me is Dr. Swauncy from Signature Health and Wellness here in Laverne. We're going to recap and talk to you a little bit about COVID-19 today. First, let's talk about the city. With the city, City Hall's lobbies and Code's lobbies are closed currently. The drive-through here at City Hall for water billing is closed. Employees are working modified schedules. All events have been postponed. Most recently, the block party has been postponed. City parks and the city library are both closed currently, but the Greenway is open if you care to get out and walk. Initial numbers as of yesterday for COVID-19 here in Rutherford County, we have 269 positive cases, 2,161 negative cases. Of our positive cases, 107 have recovered, leaving an estimated 162 still active. We've had 6 deaths. We don't have a breakdown currently by city of the infected cases, but it is being monitored closely. Testing sites have been announced by Governor Lee all throughout the state, free of charge to residents. You do not have to be symptomatic. You can simply show up and be tested. If you go to the State Health Department website, you'll see a listing of all of the testing facilities for this Saturday. For Rutherford County will have the health department open and testing from 9 a.m. till noon on Saturday. Their address is 100 West Burton Street in Murfreesboro. They will have 2 lanes open, so it is a first come, first served basis. But again, if you can't get in at the one in Murfreesboro, you can use any of the facilities here in Tennessee. With that said, we have Dr. Swauncy here. Dr. Swauncy, do you want to take us through some of the information you've got for us on COVID-19?
Yeah, I would definitely like to do that. I think we heard enough about the coronavirus. I wasn't going to talk about the coronavirus, but I think everybody probably been inundated with the news about what the virus actually is. We know that most people infected with COVID-19, you're going to experience some mild to moderate symptoms, and most people will recover. But it's the ones with the older people and people with underlying issues, underlying medical conditions, whether it be diabetes, heart disease, underlying respiratory problems like COPD or asthma. Those are the ones we're really concerned about as well, that I would call high-risk patients. And we know that the best thing for us to do is try to flatten this curve by staying at home. And I think that's what I kind of want to focus on today. What can we do in the community to emphasize that point, a nail in that point? And I know sometimes we still have to do essential things, like go to the grocery store or go to the bank, but what can we do to maybe lower the incidence by doing certain things? So the main thing is stay at home if you're sick. I got to emphasize that first and foremost. But if you do have to go out to Kroger or Walmart or any other grocery stores in the area or places like that, try to stay at least 6 feet away from other people while shopping. Let's cover our mouth and nose with some kind of cloth face covering, masks when you go out in public. If you do have to go in person, go during hours where it might be less traffic, like early morning or late in the afternoon or late in the evening. Or some stores even offering special hours for people who are 65 and over, or people who got high risk, the ones I mentioned earlier. I actually went to a store this past weekend, and I told me I had to leave because I wasn't 65. So some stores around here are doing that for sure. If you do have to go inside the store, disinfect the cart. Hopefully they got some disinfectant wipes if they're available. Try not to touch your eyes, nose, or mouth, what's known as the T-zone, the eyes, nose, mouth. Keep your hands away from there. And if possible, try to pay with a touchless system, like with Apple Pay, or I think Google has a payment system too. If not, you have to use cash or credit card. Make sure you disinfect your hands when you leave the store, and make sure when you get home to wash your hands thoroughly for at least 30 seconds. Those things we can do. We have to go to the store. If you're getting deliveries like Amazon or even the U.S. Postal Service, try to limit person-to-person contact, and even then, again, use hand sanitizer after accepting deliveries and after checking the mail. Things we still have to do in the community. We have to go to the banks. If you go to the bank, let's try to do online banking or drive-through ATMs. Again, if you have to do the drive-through ATM, hand sanitizing is a good idea. Getting gasoline, using gloves, disinfecting wipes, good idea to do. And people still got to go to the doctor. So a lot of doctors now, including myself, are offering telemedicine visits, e-visits or telephone visits. But sometimes you have to go in. And if you still have to go in, still practice those same techniques that you go into the grocery stores. Try to stay 6 feet away from other people. Wear the face coverings. Make sure we, using hand sanitizer if you have to go into an office. And of course, we're doing our part in the office to make sure everything is sanitized and clean as well. And usually after you leave a doctor's office, if you have to go to a pharmacy, the drive-through pharmacy, curbside delivery, things are other options besides going inside the store, asking your doctor for longer prescriptions for maintenance medicines like a 90-day supply. All those things could be helpful as well. So I just want to emphasize what we can do as a community to kind of lower our risk and to flatten this curve.
Thank you. Now, we understand everyone's watching on Facebook Live, and you're encouraged to send your questions in while this is going on. I know we've got one question already from Martha Brewer, who has asked, when are the tests available here in Laverne? So that's a wonderful question. Tests have been available here in Laverne through private practices since, I would say, almost the beginning.
Yeah.
And so you would just need to make an appointment with that office and go through that procedure. Dr. Swauncy, does y'all's office, do y'all offer that as well?
Yeah, we were one of the testing sites here in Rutherford County when it first started. But I will emphasize, I think that's the biggest confusion amongst not just doctors, not just local government, but I think just nationally is the whole testing issue. Because initially it was like you could test only people with symptoms, with fever, cough, shortness of breath. Now they're pushing, I noticed yesterday talking about testing people who are asymptomatic, who don't have symptoms, because we're not getting a true picture of what this disease is actually doing. So I think testing is probably the biggest confusion across the board with the whole COVID-19. You hear about antibody testing now too, and they're not sure if it's reliable or not. But again, I think we need to be testing more people, not just the ones with symptoms, to get a full grasp of the number. What they're saying now is some asymptomatic patients are spreading the disease who may not have no symptoms. And I read yesterday in New York that 80% of the pregnant women coming in for delivery are testing positive for COVID-19, but they have no symptoms. So again, this whole testing thing is still, I think, probably the biggest confusion. That's why I want to focus on what we talked about earlier, what we can do individually, I think, is the most important thing. Testing is important, don't get me wrong, but I think we can all take the other precautionary measures that we talked about, staying at home, covering up, hand washing, until we get this thing figured out.
Well, I think this next one is definitely for you.
Okay.
This question comes in from Stacy Lanker. It's about wearing gloves. Is wearing gloves a problem for cross-contamination?
Yeah, I think it is. I think it's okay to wear gloves if you're going, like I mentioned, when you're getting gas, put some gloves on before you grab the pump the gas and dispose of the gloves. But I know you see it on social media, people wearing gloves all day or people wearing gloves and not changing them. It's just like you still could be contaminating other things. If you're touching something or if you're touching your face or if you're wearing gloves in the grocery store and touching the cart and go home and touch your car door, I'm not sure if you're doing yourself a service or not. So if you be mindful of changing gloves when you do certain things, I think that's the best idea.
And whenever we change gloves, want to remind everybody, please make sure you're disposing of those in proper trash receptacles versus just throwing them down on the street. This is all of our communities. We want to see it as beautiful as possible. I think we have another question coming in right now. This one is again from Martha Brewer. She's wanting to know, how long does it take to get the test back? Mm-hmm. And so that kind of varies a little bit from place to place. I know the health department is saying about 72 hours, and then there's a bunch of different private clinics. Do you have any?
And that goes back to the statement of confusion. When we first started doing the test, it took us about a week to 10 days to get back. Now they're saying 72 hours some places. But now some places got 15-minute tests supposedly, but are they accurate or not? I think they're pushing stuff through so fast, the FDA. So there are some 15-minute tests supposedly out there. I don't have those tests in my office, but I know ours take about 5 days to return. And you said the health department?
Health department is stating that theirs is a 72-hour turnaround.
72 hour. So I think it varies depending on what test you're using. If it's a private lab, is it one of the big labs like Quest and LabCorp? It varies.
So here's another one that deals with cross-contamination. This one's from Melinda Matilla. She says, I usually take reusable tote bags to the grocery store. Is that an issue? Should, let's see here. Should they be washed after that, or she's not sure how it spreads?
That's a very good question. I think they probably should be washed after any time you go out to a grocery store or to the community, or just leave it at home and just use the plastic bags. I know it's not environmentally friendly, but this is a different time we're living in right now, so it might be time to put those reusable bags to rest for a little while. I don't know the exact answer to that question, but that's what I'm just thinking just off the top of my head. That might be the best thing to do, is just use the plastic bags from the grocery stores.
Wonderful. Well, Dr. Swauncy, thank you for being here with us and talking with our community here about COVID-19. And I'm sure we will be getting more and more updates as things go along. So again, thank you for being here.
Thank you for having me.
And Laverne, just stay tuned. We will have more updates as the days go on. But stay safe and let's stop the spread.